Each with their ailment, as early as 6 a.m, they come to Panyadoli Hills Health Center too and sit, even when they know that the in-charge may turn up 2 to 4 hours later. At 9 a.m, he comes, ending their wait.
Because you have to look for water, sometimes you don't get.
Semi Drileba is an enrolled nurse at this health center, and on days that he does not get a border or motorcycle transport, he walks, a distance which takes him 2 to 3 hours.
Other people will not tolerate that. They first started by absenting themselves. But you have so many pregnant people. So they always find that because we don't have a midwife, and then Panyadoli Health Center is very far. Sometimes we tell them to go continental, but then when the labor comes abruptly, we find some of them delivering in their homes. So this one has now made the home delivery to increase even.
The Minister of Health says that there is a challenge in distribution of health workers.
Not because we are totally deficient of health workers, but because of our recruitment policies. And there are some innovations which we had neglected, which we are visiting.
Regardless, the patients need treatment at the only health center nearest to them. Because of the uncared for bushes, most people have malaria. There is also shortage of water, which has increased water-related diseases like diarrhea. Simply a case of many people using a few resources, according to the Ministry of Health. The existing populace is aiding this with a high rate of births.
You find it, somebody having, let me say, 4 kids, and the spacing may even be just a year.
Our dream of becoming a middle-income country by 2020 or 2022 has to be supported greatly by our intervention, like limiting the number of children through a normal process of improving on the birth spacing. Because the number increases when the space is small. Every year, if you are pregnant and another year you are breastfeeding, you are liable of getting about 12 and so children.
A highly populated area with high quality in terms of education has minimal chances of diseases and need for reproductive health services.
Here we over-interact with the environment, we over-interact with soil, therefore acquire a lot of wild germs, some of them coming out of poor deposition of wastes, and then we are prone to diseases. That's why we have a lot of outbreaks.
And all these people end up at health centers, which are not well equipped to handle a population which increases through an explosion each year by over 1 million people. At MPG Hospital, some health workers told us that they are overwhelmed with patient numbers, yet they are few. Some people go home without service. For example, Semi tells his patients to come the next day.
You work until you get annoyed.
Our institutions are overattended. There is some overconsumption. Sometimes people don't need to come there. A small headache because of exhaustion, flu, and if you like 20 people have flu, all of them will come to an institution. And sometimes you don't give them medicine. You tell them go and take some water, and this one is going to go. Yeah. But they will be in that service area, and then they create a sense of overpopulation in those centers.
With half of Uganda's population being youth below 18 in their reproductive years, some with no basic education, it is no surprise that the population is ever on the increase.
And the reason is simple. If you are educated, by the time you go through universities, you will avoid being a child mother.
Only 3 in 10 of Uganda's women use some form of contraception. The unmet need for family planning is at about 40%. No wonder the population increase is not easy to tame.
Within 5 years, we are targeting to reduce that demand to about 10%. And that will improve on the fertility rate.
Currently, according to the 2011 preliminary Uganda Demographic Health Survey results, Uganda's total fertility rate is at 6 children per woman throughout her reproductive years. If the total fertility rate were to be reduced, Uganda may end up having less frequent need of health services. The population will be qualitative and more productive enough to sustain itself. Florence Nalimba, NTV.